University of Ghana College of Health Sciences, established in 1999, is comprised of the Medical School, Dental School, School of Public Health, School of Allied Health Sciences, School of Nursing, and the Noguchi Memorial Institute for Medical Research. The mission of the College of Health Sciences is to produce highly qualified and competent health professionals and medical scientists to provide promotive, preventive, and curative services to meet the health needs of the nation and the global community through world-class excellence in teaching, research, and dissemination of knowledge. In late 2008, the college began a project to advance healthcare education through open educational resources, commonly referred to as OER. OER are learning materials that are openly licensed so that they can be used, adapted, integrated, and shared without licensing fees or other copyright restrictions.
The president of the University of Michigan, Professor Mary Sue Coleman, visited the University of Ghana to acquaint herself with the partnerships that were running between the two institutions and to explore possibilities for more partnerships. Following that, we were approached by the University of Michigan to find out if we were interested in OER, and we said yes. So together with KNUST, a grant was applied for, and fortunately for us, we had it. So started the OER projects at the University of Ghana, and of course at the University of Science and Technology as well.
Over the past year and a half, lecturers and senior members of the medical and dental school have developed interactive teaching programs for obstetrics and gynecology, surgery, internal medicine, pediatrics, and dental nutrition.
I'm in charge of the OER project in the College of Health Sciences.
I'm the faculty member directly responsible for ensuring the production of the OER material here at the College of Health Sciences.
I've been involved already in research and development of teaching aids for the dental school. So when OER was brought to the notice of the college, our school was drafted into it, and I was invited to join the team because of my expertise in handling the internet and media programs. So I was drafted into it.
I'm involved with the OER project in trying to produce a clinical teaching material for clinical skills to help our students improve their clinical skills and improve upon what we are able to teach them through didactic methods so that they can improve on their skills. Basically, that's my role in all of this.
Last year, I was actually introduced to Dr. Danu when he actually got the initiative to produce OER materials, and upon interactions we realized there are so many things we can actually do together. Hence I got on board to try and help produce the OER material.
I play the IT technical role in the implementation of the OER. So I support its installation, technical support basically. Yeah.
This documentary explores the college's motivations for participating in OER, the impact of OER on health science education, and plans for moving forward.
I'm excited about it because the College of Health Sciences have started it.
Well, personally, I've put some OBGYN OER stuff together, like there's an interactive teaching thing on hysterectomy, one on cesarean section and one on episiotomy. So I personally was involved in producing those three. Then have worked with other faculty members to produce other material, like the clinical examination in gynecology, and we've done a series on internal medicine, surgery, and pediatrics also.
As far as OER is concerned, the university's target of making sure at least half of its population is taking courses outside the campuses, and it has a vision of providing rich content electronically for its students. So OER provides that great opportunity for the university to achieve that aim.
Working with lecturers and senior members of the college has been pretty interesting, amidst trying to help them to be able to focus on the production of materials regardless of unavailable time on their hands, as it were.
It's a slow process. And when we started, the impression was that this was going to pick up very fast, but it's a slow process, simply because people don't get specially protected time to be involved in producing this material. It's because of the shortage of staff, the small numbers that we have. People have to do this in addition to everything else that they do. So it's a slow process. But once people see what they produce, they get excited and want to do more. Yeah.
Currently, yes. We are working at getting OER materials, local content from the area of dental morphology. It's been a challenge for the student to come to grasp with the normal didactic lectures and models. So that's one particular area. Another area is dentures, the laboratory work the students go through. Some of them have a lot of challenges there too. That also is one of our priorities. And then orthodontics, where they use wiring materials to fix dentures in the mouth. That has also been the third priority area we want to look at. But broadly, we are prioritizing our lecture presentations, develop it using Camtasia so that we can give copies that students to look at, watch, and study before they come to the lecture. And that way we hope to give the student a broader perspective of what we teach so that they can participate through questions and further contributions than we are doing now. So these are the major areas we want to look at.
If I would use one word, tremendous impact. We started with a small committee, made up of representation from all the constituent institutions. The essence of that was to get these people, the representatives, to serve as focal points for each of the institutions. For medicine, it has been, the impact has been tremendous. They started a new program, the Graduate Entry Program, which runs parallel with the traditional program. And that program needed something like that because we weren't going through the traditional, way of teaching and so on. Now, in the College of Health Sciences, one major challenge that we have has been that of large numbers of students and poor infrastructure. You see, and we've been trying over time to find out ways of solving this problem of large numbers of students, poor, obsolete infrastructure and, inadequate infrastructure. And one way is through the OER production, which came at an opportune time.
The students who use the material, what I get from them is that they find them helpful. The material are things that help them understand what they are taught better. And also, it prepares them better before they come to the ward for any discussion. And faculty members who also used it have found it helpful because some people in our department have watched the material themselves and had discussions with their students on the material. So generally, I mean, people have found them to be helpful. Yeah.
Really helpful, because sometimes it's quite difficult to get enough information from a surgical procedure. For example, you go to theatre and they're quite busy, and you can't ask them at every stage what's going on. So to have a CD that you can watch at your own convenience, kind of as many times as you want, which you would probably not be able to do so because of a very busy timetable in lectures. You won't be able to go to theatre as often as you want. So that CD is really good because you can replay it over and over again. Because of the labels as well, you know exactly what tissues we are going into. And it's for a first timer as well, when you've got no experience of what a cesarean section is, for example. It's really good because it kind of gives you an idea before you go in to theatre.
We haven't had a very tremendous impact yet, but with some of the OER materials we have adopted from your institution, students now have access to some of the content of the issues we want to teach them before they come to the class. That is having a positive impact. Another impact, I think, is the general awareness in the school that this document that we've been seeing on the internet can be locally developed. That awareness is there, and most of the faculty members are eager. Our little challenge, I won't say little challenge, major challenge, be getting adequate time to get it running. That is it. So awareness both on part of the faculty members and majority of our students about the OER and accessing it has been very positive.
Well, we are still in the, formative stages, but I think the one big advantage is that students can have access to teaching materials anytime. And therefore, it should be possible for them to overcome some of the handicaps that may have existed when this was not available. In other words, if you missed the lecture, then that was it. So I think that it has the potential to make a tremendous impact on the way our students learn, the impact of the teaching itself.
In the past, you would find students, about 25 students on a ward. When there's a demonstration going on, some of them would not see at all. Others may not even come to class. With the OER, system, the lecturer is videoed demonstrating this sort of thing, so that the students can play it back in their rooms. They have access to the material, so they can watch it. And the good thing about the OER materials is that, it is interactive. So students can answer questions and so on after watching the video, and this is making a change.
And as well, the ward rounds, there are lots of students, and they are really good, but I think because there are so many students, you may not always get the opportunity to get as much access to the patients. So, because the patients can't take too many students coming to them. I don't think it's nice to have about 5 or 6 people coming to ask you the same question all the time. Often again, you deal with private parts of people, so it's not really nice to have people coming to join. So it's nice to have a CD that allows you to kind of go over these things in your room without feeling embarrassed about the patients. Just the whole thing, knowing what it's about before you go to the patient and seem really clueless as well. Because there was a section on examination of the patient, the abdomen, pelvic masses, and that was quite well done. So I thought overall it's a good thing.
Outside of OER, some individual teachers made their own tiny little films of themselves and this had a massive impact. What will happen when this is done is that it will tend to standardize things, and the students will expect that this is what they'll be expected to know. And those are the ones I was talking about, where to a very narrow population of students. So we're expecting that this will hit a much wider spectrum of students, hopefully in other institutions as well, because really I don't believe in duplication. I think if it's been done elsewhere, unless it's a different form of human being, it's good enough for any and everybody. So that's really, I think it will have quite a good impact, because we are really having a problem with students practicing and being able to do things which they should be able to do in practice. And it's really telling on the quality of students that we're producing. So the hope is that if they watch these videos and they sort of internalize it, they can then have questions to ask their teachers, and then they can improve on their skills.
What has happened has been that we have a number of old professors in the system who have got a wealth of experience, you see, they have been roped in, and they are so enthusiastic about OER production, that a lot of them have produced some material, and this is very good because of their experience, in teaching students and so on over such a long time. They are the right people to be involved in it. Of course, the junior faculty are also involved in it, but the key thing is to get the old professors with the wealth of experience getting involved in OER production. So the impact has been great.
The first thing is to get management or the administration to buy into it. Once that is done, most of the challenges can easily be overcome. In this part of the world, the number one challenges we usually face is infrastructure. For a very successful OER, campus networks and all that should be very solid. I believe in that. Otherwise, faculty will do a lot of work producing quality content, and accessibility will become an issue. So start by getting management to buy into it. Once that is done, they will do whatever they can to make sure infrastructure is right.
To start an OER program, definitely first we need to convince faculty that they don't need to feel threatened by material being put out in the open for everyone to use. And also convince faculty that the fact that we are making this material, let's say, accessible to students 24 hours, doesn't mean that the students will not participate in the regular classroom and ward teaching. So that, let's say, that mental barrier needs to be overcome. Then, there's a need to have, let's say, a fully staffed office. We've started out now. We've got kind of like an office that's staffed by one person, but in the long run, one will need to get more people in that office, because when everything picks up, you will definitely need more people to be working on to produce material at the rate that it should happen. Then also, there's probably the need for us to, as we produce OER, to look at our traditional teaching methods, so that the OER material produced doesn't become a total substitute for regular teaching. So that students gain something from the OER, but need to come to the classroom and need to come to the ward to get something extra that cannot be got from this e-learning material. Then for the material to also be really open access, we need very good internet connections, over the whole campus.
My advice, basically, it's there are a lot of challenges, but one has to resolve. Also, sharing with other institutions that have already gone that path will be very useful. That is the only way to avoid some of the mistakes that they made.
I would say cooperation and collaboration. You want to maximize the use of your resources. If you're in a country and there are things unique to your country, or you would like to use as many different people as possible. I really don't believe in every single institution having a full set of OER material. I think that if it's available for everybody to use, since it's an open resource, I think it should be available for as many people as possible, and that people should do as best as they can to collaborate. And I think for me that's the key word.
One very important issue is to get the university on board, get the faculty to see the whole OER and how it's supposed to work, the benefits that it will bring not only to the university but to the individual faculty itself and the students. So I think that's the major issue, and I think that if we keep working on it, we should be able to get the whole university to come to understand what the whole thing is about.
As far as OER is concerned, the university's target of making sure at least half of its population is taking courses outside the campuses, and it has a vision of providing rich content electronically for its students. So OER provides that great opportunity for the university to achieve that aim.
Well, the next steps here, for now, we've done the basic production of things for the medical school in terms of clinical methods. And our college has 6 different schools. So our next step now is to focus on the dental school and produce material, basic clinical examination material for the dental school. And we're going to go around each of the schools so that each school has a production. Then we'll move on now and kind of like turn it open, and people could walk into the office at different times, have discussions, and get things produced.
In the nearest future, I would like to see a situation in the College of Health Sciences whereby lecturers and individual physicians being able to capture various cases on their own, and it becomes a norm where they always have cameras on their own and capture cases and just bring them to the OER office, where we would always put them in formats that can be made available on the OER database, as it were.
We are working at getting OER materials, local content from the area of dental morphology. It's been a challenge for the student to come to grasp with the normal didactic lectures and models. So that's one particular area. Another area is dentures, the laboratory work the students go through. Some of them have a lot of challenges there too. That also is one of our priorities. And then orthodontics, where they use wiring materials to fix dentures in the mouth. That has also been the third priority area we want to look at. But broadly, we are prioritizing our lecture presentations, develop it using Camtasia so that we can give copies to the student to look at, watch, and study before they come to the lecture. And that way we hope to give the student a broader perspective of what we teach, so that they can participate through questions and further contributions than we are doing now.
Of course, the other issue is, right now this whole thing is being funded, but when it is all over, the university will have to find the funds to keep this project going. hopefully it should be able to do that. As far as the side of the students is concerned, I think they would welcome it. So I don't foresee a big problem there. One other area would be training the faculty to be able to do some of the simple things. Chris is doing a bit more of the complex things, but I suppose there are simple things that we can train the faculty to do. Now we are still working on the policy, and I hope I'm wrong, but I can foresee that people may have problems with the copyright aspect, but I'm hopeful that we may be able to convince them that, you know, it is beneficial to the university and to themselves if they can subscribe to, for example, the Creative Commons and the various aspects of it. Yeah.
The policy, it should be adopted by the university. Currently, it's gone through the college. The university setup is very bureaucratic. You know, it has to go through the college executive committee, college academic board, and then the university executive committee and the university academic board. So far, we've completed that of the college, and it's gone to the university. The vice chancellor has sent it to the schools within the university, other schools, the humanities, law, and so on. But I think that what we need to do is for us to go and demonstrate some of the OER productions that we've done here to them, for them to see it for themselves. Then they will be in a better position to appreciate the documents, But as it is now, without seeing what the production is all about, it's very difficult to look at policy, to consider it. So that's what I'm going to do with the help of the Vice Chancellor. Then they can look at the document and it will be passed finally at the academic board of the university.
Well, I think that if all African universities, not only at the university level, if the universities are able to adopt the OER, one, we are resource poor, we don't have enough resources, and our educational systems are struggling with funding from our government. So if OER is developed locally with local content and also collaboration with other institutions, and these materials are readily available, it will be a big plus for our education, both for the students and the lecturers. So I think all universities, this must be promoted in all African universities.
With the challenges that we face as a continent, as far as getting faculty to teach is concerned, I will advise that other coding universities in Africa go this way, because that way you get to digitalize content, quality teaching materials that can be reused over time, and with just little improvement as time goes on. So my advice is let's embrace OER. Let's collaborate as much as possible and share ideas. And with that, I think we shall progress and produce quality graduates for our respective countries.
It's not impossible to produce e-learning material within Africa. And it's also, not impossible to get OER material out. Because I believe there are people in our different countries who have the skills required for production. They might not be in our institutions, but probably if we looked hard enough, we could locate some such people who can provide the technical support for the material to be produced.
The message is that OER is good. It's an excellent idea. It's very innovative, and it will be useful for all African universities, to get on board. The thing to do is to start from the grassroots and work your way up. You see, if it's a bottom down approach, the top down approach, it doesn't work very well. But if you get the people at the grassroots involved in it, then it will seep through the system. And then the experienced people must also be roped in, because they have taught for several years. They have a wealth of experience, which can be put into the production. But they must mentor the junior faculty also to get involved, so that together, the OER system would grow in any new university.